I'm Dr. Harold Ashcraft. I'm a low vision optometrist, and I'm a member of the International Academy of Low Vision Specialists. I'd like to tell you today about a patient that I recently saw. She was a young lady in her mid-20s, whom I'll call Lauren, and she had Stargardt's disease. Now, when she came to me, she had a couple of concerns. The first concern she had was with driving. She had been driving, but she couldn't pass a normal driving test, and her driver's license was coming up. She thought she was seeing worse, and she was really concerned about driving because she was going to school and she was working, and if she wasn't able to drive, this would be really a big thing to her. The second concern she had was reading. She had found that when she'd hold things very close, meaning the computer or reading, she would see better. But holding things close means that she had a lot more strain on her eyes. She had to focus her eyes. She had to turn her eyes in, and this caused strain on her focusing and with her eye muscles, and she would fatigue very quickly. So she'd be tired and not be able to do that very long. And the third problem that she had, she said she was very sensitive to light. She had tried different sunglasses, and they were either too dark or too light, or they didn't seem to be the right color. So in a moment, I want to tell you about how we helped Lauren with her vision, but first let me give you a brief summary of Stargardt's disease. Stargardt's disease is an inherited genetic form of macular degeneration, and it's commonly called juvenile macular degeneration. Now in Stargardt's and in macular degeneration, the macula, or that central part of your vision, the part right in the middle which is responsible for clear central vision, it's damaged. And so the first thing with Stargardt's patients is that they don't see very well, and their vision can get progressively worse. And they have problems seeing both far and possibly near. Now, because it's inherited, they could be born with it. It could develop in their early school years or through their 20s. And so with a child in school years, they have a series of issues. Number one, they have blurred vision. This can interfere with seeing the board. This can interfere with doing homework. Because most school and most learning is visually oriented, this can really slow them down and make them appear that they're not learning very well. They can have trouble with sports. They can have trouble seeing faces. They can certainly have a lot of trouble when it comes to getting a driver's license, because most of the time they can't pass the normal vision part of the driver's license examination. And for a person in that age, not having a driver's license can really be a big effect on their life. The second issue that they can have is color vision. Sometimes they don't see colors quite right. They can see black spots or blanking or dark spots in their vision, and parts kind of disappear. And sometimes they'll be light sensitive. So back to Lauren, what did we do for her? The first thing that we did for her was to address her driving. That was her number one concern. She had been driving. She had a pair of special bioptic telescopic lenses which allowed her to drive, which means that she had glasses with very small miniature telescopes in the top. She could see a car, she just couldn't see a sign. So she would look ahead when she needed to see a sign or any marker on the highway or the street. She would tip her head down and just spot that and see that. I found that for Lauren, she wasn't seeing well because her prescription had changed. She had become more nearsighted. And so imagine this, if you're nearsighted or farsighted or have a vision problem, and if you wear glasses or contact lenses and you take that correction off and look through a pair of binoculars, your vision won't be that good. And that just shows you that all these devices, first thing is to have the best possible distance vision. So we changed her prescription, changed the prescription in the bottom of her lenses. There was nothing wrong with the telescopes, and that allowed her to be able to get her driver's license. Now, her second issue was reading. This reading close, she could do it, but not for very long. So we made some special glasses that helped her for reading, where she could hold it a little closer, take the fatigue off the focus system, the fatigue off her turning her eyes in toward the reading, and then she was able to continue to do reading and the computer. And then when it came to sunglasses, we had to try some different things. As I mentioned, she had tried normal lenses, she didn't really like them, so we tried some unusual colors. We tried plum and we tried ambers and yellows and different colors, and found her a color and darkness that she liked. So we were able to help her with her driving, help her with her reading and computer, and help her find the best color, darkness, and tint for her sunglasses. And she was very happy. So if you have a young person and they don't have normal vision and they're kind of blurred and maybe they don't see as well and possibly the standard procedures don't help them, give us a call. And we offer a free consultation on the phone. We like to learn about our patients and then see how we can help them. And I'm sure there are many new technologies and many new things can be done so patients with Stargardts can function normally and use the best they can of their vision and continue to have a good quality of life.